Okay, so hi everybody. I am Nicole Hunka. I am from the University of Akron, and we are going to talk about chronic inflammation and lifestyle, specifically sleep, stress, and related factors. So as a reminder, this is actually the third part of a three-part series. In part one, we talked about chronic inflammation and lifestyle and focused on rethinking perspectives of health and healthcare. And then in part two, we focused on nutrition and related factors. And then in this part, we are going to focus on stress, sleep, and related factors. And those related factors are primarily going to be exercise. So what are we going to cover today? We're going to do another quick review of chronic inflammation as a contributor to chronic disease. We're going to talk about the influence broadly of stress, sleep, and exercise on inflammation and resulting chronic disease. And then we're going to revisit the same question that we've talked about in the last two presentations, and that is, does traditional healthcare adequately appreciate and integrate lifestyle as a means of treating and preventing disease and improving quality of life? And if not, should we consider shifting to more thoroughly integrating lifestyle medicine into our existing practice? So this is about integrating it, not replacing it. Excuse me. So we may have a few people that were not in attendance for the last two sessions. So we're going to do a quick review on some things we've already covered just to make sure we're all on the same page. So let's start with chronic diseases. So chronic disease cause the most death and disability worldwide. 6 out of 10 people in the United States have at least one chronic disease. 4 out of 10 have at least two. According to the CDC, the majority of the $4.1 trillion in healthcare expenditures are for these chronic conditions. It is very well documented that many chronic diseases are largely preventable or modifiable through lifestyle. So the American College of Lifestyle Medicine has reported that 80% of healthcare spending is tied directly to the treatment of chronic conditions that are rooted in poor lifestyle. And just as sort of an example of some modifiable factors, there's some research and estimates on cancer. And according to this set of authors, 42% of cancers are attributable to modifiable factors, including things like smoking, secondhand smoke, excess body weight, physical inactivity, alcohol, eating the processed foods, but not enough of the healthy foods, fruits, fibers, vegetables, and even, ultraviolet rays when it comes to the sun and skin cancers. So many behaviors and lifestyle factors that contribute to chronic diseases have this common element of chronic inflammation. So we know with acute inflammation, that's adaptive, right? It's the body's response, beneficial response, the immune system response to physical or biological threats, injuries, pathogens, right? So the body responds and then it downregulates. It's the chronic inflammation that's the harmful piece. So this is chronic, systemic, low-grade inflammation. It's just sort of smoldering in the body with no real purpose. And this chronic, low-grade inflammation has been referred to as the common soil of diseases. And numerous references discuss the link of chronic inflammation to just about every chronic disease, from cancer to diabetes to heart disease to arthritis, on and on. So what are some factors that contribute to chronic inflammation? Well, as we said before, genetics, the environment, aging, childhood stress and trauma, as well as lifestyle factors. So things that we have at least a little bit more of some control over. It might not be easy, but at least there's a little bit more control. So eating behaviors and patterns, again, overconsumption of those processed foods that we talked about last time, physical inactivity, is certainly a contributor. And, even if a person physically looks well and fit and, is of appropriate weight, that does not give a person a pass to avoid activity. Sleep is also disrupted sleep, I should say, is also a contributor to chronic inflammation. Not just stress, but poor stress management. A lot of times we can't get away from stress, and it really comes down to how are we trying to manage the stress? Are we, managing it in healthy ways, or ways that just really are promoting more inflammation? Drug and alcohol use, smoking, even limited social connections and activity can promote inflammation, which then leads to, the development, is a factor that can lead to the development of some diseases. So, given the impact of chronic diseases in the United States, and certainly the cost associated with chronic diseases, the American College of Lifestyle Medicine has really been sounding the alarm to integrate lifestyle interventions into healthcare practice. And this just doesn't include physicians, it's all healthcare providers. So working lifestyle medicine even into social work and counseling and related healthcare fields. So as a review, in case you weren't here in any of the previous presentations, lifestyle medicine is actually a medical specialty. It's newer, but it is a medical specialty. It uses therapeutic lifestyle interventions as a modality to treat chronic conditions. And again, it's to be used in an integrated way in the provider's existing practice. This doesn't mean dropping your practice and everything you know and have been taught. It's about integrating these pieces into your already existing practice. Lifestyle medicine uses evidence-based prescriptive lifestyle change to prevent, treat, and in some cases, even reverse certain conditions. They really focus on 6 pillars, which is nutrition, physical activity, restorative sleep, stress management, avoiding substances, and positive social connections. Again, just a little bit more on this if you're new to this series. So this link here is for the American College of Lifestyle Medicine. It's a professional society. And if you're interested in this topic, and if you have some time, looking at that website is pretty interesting. They provide a host of resources for healthcare providers, again, not just physicians, nurses, counselors, healthcare providers across the board. They have handouts, literature, research studies, continuing education opportunities. So there's a lot there. Physicians can be board certified in lifestyle medicine. There are certifications available for other healthcare providers as well. Curriculum is available for residency programs, and they really support and recognize the creation of lifestyle medicine certificates across campuses. Another big piece of this is that they really encourage the development of lifestyle medicine interest groups. So these are student-led, faculty-supported groups. And currently, lifestyle medicine interest groups are active at over 100 campuses across the United States. And more than 200 residency programs are now including lifestyle medicine in their curriculum. So this is taking off. Again, this is a newer field, a newer specialty, but it's taking off. Okay, so that was all the review from the previous times. We covered nutrition, which is one of the lifestyle medicine pillars in our last presentation. So now let's briefly discuss some of those other pillars. We're obviously not going to cover them all, but let's at least briefly address stress, sleep, and exercise. Okay, so in regard to stress, we have a stress response. The sympathetic nervous system activates. We have the hypothalamic pituitary axis, that HPA axis that activates. And that HPA axis is related to the release of glucocorticoids, right? Cortisol. We know that continued activation of the sympathetic nervous system and that HPA axis is notably associated with inflammatory and cortisol, I need to add the L there, cortisol-related dysregulations, which seems to increase the risk of disease development. Now, relatedly, elevated levels of various inflammatory markers have been seen in chronically stressed individuals across various studies. And this is frequently observed in studies that look at dementia caregivers. So caregivers who are, they are caretaking maybe an elderly relative with dementia that lives in their home and requires this constant care. A lot of the research on those dementia caregivers will show these elevated levels of inflammatory markers, often related to chronic stress. So the prolonged cortisol release observed in chronic stress is associated with lots of things, including weakened immunity, among other things, but also high blood sugar, high blood pressure, weight gain, insulin resistance, just to name a few. And if we really just look at the high glucose and blood pressure, weight gain, and insulin resistance, those particular factors are factors that are really associated with metabolic syndrome that we discussed last time. And we know when we have those factors that are associated with metabolic syndrome, it increases our risk for diabetes, cardiovascular diseases, even some cancers. There's some suggestion that high and prolonged cortisol release is linked to poor cognitive functioning and even the development of Alzheimer's disease. So when we think about chronic stress and the duration, what does that look like? Well, it could include persistent events. So again, like caring for a chronically ill family member over the long term. It could include recurrent acute stressors, like marital discord that is happening frequently or even daily. It could also include events that continue to be experienced as overwhelming long after they ended. So if a person experienced some sort of trauma or an assault of some sort, right, that experience is over, but they continue to experience, the effects of that long after. So a little bit about stress and telomeres. So telomeres are protective caps at the end of chromosomes. They shorten with cell division. Shortened telomeres die or become pro-inflammatory, and this has been associated with cellular aging, which is then associated with disease risk. So chronic stress and the prolonged and excessive cortisol that comes with chronic stress have been associated with shortened telomeres. And the association is that the cortisol seems to impact the supply of a particular enzyme that actually replenishes the telomeres. Now, there are some suggestions that there are stress buffers that can also impact telomeres. So a couple of researchers at the University of California, San Francisco talked about this. And they said that exercise seems to moderate the stress-telomere relationship. And this particular researcher said that telomeres will not necessarily take a hit or as big of a hit as long as a stressed person is engaging in consistent health maintenance. So consistent exercise, healthy diet, proper sleep, so on and so forth, as they are dealing with whatever the stressors are. A colleague also agreed with, the exercise as moderating, being a buffer to stress. And this particular individual also really spoke about how a strong social network can also be a buffer to stress. Now, this strong social network is not something that is going to be discussed in this particular presentation, but it is one of those pillars of lifestyle medicine. And it seems to be, one of these factors that maybe isn't as appreciated enough as maybe it should be. So that might be something to, look into a little bit more. So a little bit about childhood stress and inflammation in telomeres. So there are several studies on this particular subject matter. So we know that multiple early life adversities, so childhood neglect and abuse, seem to be associated with short telomeres throughout life, even into adulthood. It seems to these life adversities in childhood seems to predispose the person to inflammation, again, even into adulthood, having these higher levels of pro-inflammatory cytokines associated with these earlier life adversities. So after years of chronic stress arousal, so again, this could be related to years of abuse, and this can even be later in life. One of the researchers, again, from the University of California, San Francisco, noted that after all these years, we see effects that override normal aging, making our telomeres look like they are from a significantly older person. So this sort of a cellular aging that can take place with this chronic stress, even from young years. So we know that chronic stress can increase the risk for physical and even some psychiatric diagnoses and disorders. We know that it seems to be, at least in part, due to inflammation, that HPA axis dysregulation, impact on telomere length, and other related biological factors. But it's also due to the behaviors that are often associated with chronic stress. So if we think about stress and how we cope, right, chronic stress can further impact health based on how we are trying to cope with those stressors. So there's a whole list of things. Think about when someone is stressed, when you're stressed, when anybody is stressed, right? How that may, for some people, impact eating patterns, food choices, quote unquote, comfort eating. It would be nice if we're stressed out, if we could do everything we could to try to combat the effects of stress. But a lot of times, we're looking for the comfort foods that are often those processed refined foods that clearly are not good for us. I think of, I don't know if we have any medical students in our audience today, but I just think of students and what they deal with, when exams come around and the finals weeks and whatnot, and having very limited time to prepare, something relatively healthy, and how easy it is just to pick up, some sort of fast food, processed food, and kind of live on that for a while to get us through those times. Typically, when people are stressed, I shouldn't say typically, but we see when people are stressed, there's decrease in physical activity, and often that's due to time constraints that come when we're stressed out. So we have less time for physical activity. We have less energy for physical activity when we're stressed. When we're making these food choices that aren't the best, when we're not engaging in physical activity, this can relate to, weight issues and a host of metabolic factors. Then, of course, when people are when people are stressed, they could, if they already smoke and drink, to increase that as a coping mechanism, or maybe even start. Of course, the use of drugs can be an unhealthy coping mechanism that just leads to, more health problems. Again, back to that isolation and limited social connectivity. And disrupted sleep is another big, just sort of thing that we see when people are stressed out. We often see people sleeping less, or maybe sleeping more, or maybe they're sleeping, as far as the duration, the same amount of time, but the quality is quite disruptive. And all of that can have detrimental effects on our health. So let's continue talking about sleep for a minute. Okay, so what are the recommended hours for sleep for general health? They vary, they vary across a person's age. But for an adult, typically what you see is somewhere between 7 to 9 hours as recommended for general health. And again, it's not just about the quantity of sleep or how long we're sleeping, it's about the quality as well. So if we are getting, let's just say, normal, healthy sleep, we go through a certain set of stages and cycles in normal, healthy sleep. So we'll go through 3 stages of non-REM sleep, and then a stage of REM sleep, and then we'll continue to cycle through those 4 to 6 times or so. So the non-REM sleep, particularly the stage 3 or the N3 stage, That's the deep, restorative, slow wave sleep. This is the delta wave sleep. And this is a really important stage of the whole sleep cycle, because again, this is where the body is repairing itself. The human growth hormone is working, and we basically are repairing ourselves. We do not want to skimp out on the delta wave sleep. So what does the duration of this look like across the night for the non-REM sleep? It typically, the first part of sleep, so again, if this is in a normal, let's say healthy sleep cycle, the first half or so of our sleep, we are, the non-REM sleep is actually longer in duration. And then as we get farther into the night, the non-REM sleep starts to shorten in duration. So then when we move on to the REM sleep, so that's the stage 4, this is the sleep that's working on cognitive functioning and memories. We're dreaming here. And the duration here is, as we get through the second half of the night, the REM sleep gets longer. So the non-REM sleep gets shorter, the second half of the night, the REM sleep gets longer. Okay, so then this is how it typically should work. But it doesn't always work out that way because of various reasons our sleep gets disrupted. Of course, this is tied also to circadian rhythm, right? Our internal clock that, when we should be awake and even eat and sleep and even energy levels. Well, the circadian, and it's often influenced by light, right? So our circadian rhythms clearly can be disrupted by things like shift work, like jet lag, right? And just staying up late for whatever the reasons are. And when that happens, it starts to disrupt these sleep cycles, which can have then an impact on health. So appropriate sleep quality and quantity the literature reports that it seems to reduce oxidative stress. It enhances removal of metabolic waste from the brain, which is important, especially when you think of dementia and, dementias and Alzheimer's. It seems to promote immune function, and it seems to facilitate memory consolidation and cognitive function. Poor sleep, on the other hand, is associated with increased risks for the following. The big one is premature all-cause death. And I always think of this when I'm bringing this point up. I have plenty of students in my classes that have said numerous times, I don't need to sleep. I'll sleep when I'm dead. I'm thinking, I don't think people grasp the significance of sleep. I just think as a general sort of the general understanding in public across the board, we may not appreciate the significance of sleep as much as we should. Anyhow, it's also related to metabolic disruption, obesity, diabetes, cardiovascular and cerebrovascular diseases, cancer, even depression. And there's a lot of decent literature on this. We're not going to go through, for time's sake, we're not going to go through specifics, but I have a lot of resources attached to this presentation that you can take a look at. So some sleep disruptors. Well, there are several, but a few would be screen time, a bigger issue now than clearly it was in the past. So exposure to bright light at night is arousing. It, increases, our level of alertness. And that blue-green light from the screens, if we're staring at our computers or on, some sort of device while we're in bed, that really seems to have an impact on melatonin, reducing levels of melatonin. Nicotine can be another sleep disruptor. First of all, it's a stimulant. And there is a link in terms of nicotine, there's a link to increased insomnia and shorter sleep duration, especially with nighttime smoking. So Nunez and colleagues stated that sleep health really should be considered in a person's smoking cessation efforts. Also, food and alcohol can be a disruptor for sleep. So alcohol is associated with disturbance later in the sleep cycle. So it's not uncommon to hear people say, oh my gosh, I have to have a drink before I go to bed to help me fall asleep. Well, maybe it might help a person fall asleep, but it often will disrupt their sleep cycle later in the overall sleep cycle, which isn't good. It's leading to disrupted sleep. Also, late eating, so late nighttime eating can also disrupt sleep. It goes against the circadian rhythm to be eating into the late hours of the night, and then it's also related to all sorts of other metabolic problems as well. So a little bit more about poor sleep and hunger hormones and metabolic issues. So poor sleep seems to decrease leptin. And leptin is a hormone that should technically, if it's being produced in the correct levels, it should make us feel full. Poor sleep also seems to increase ghrelin, and high levels of ghrelin make us feel hungry. So if we're getting disrupted poor sleep, these hunger hormones can become disrupted and basically lead to increased appetite and potential weight gain. A lack of that slow wave sleep that we talked about is also related to decreased insulin sensitivity and problems with glucose tolerance, which again can be related to all these metabolic problems, diabetes, so on and so forth. Poor sleep also seems to be related to increased cortisol and inflammation. And if we really think about this, if we're having these metabolic issues that it is leading to any sort of weight gain, this can connect back to that presentation a couple of weeks ago about overweight and obesity and how pro-inflammatory excess fat is in and of itself. So this can all of this together can just increase that inflammatory response. So a little bit more about sleep duration. So a literature review by Irwin looked at obviously several studies, but they also Irwin talked about the European Prospective Investigation into Cancer and Nutrition Study. This is a really large study. And one of the conclusions was that those with a sleep duration of less than 6 hours had significantly increased risk of cancer compared to those who had 7 or more hours. And this seems to be consistent with increased disease risk across the board. So some research also suggests that not sleeping enough, so getting that under 7 hours can be associated with shorter telomeres, which then is associated with cellular aging. Under the 7 hours of sleep has been associated with that HPA axis dysfunction. Deficient sleep has been linked to increased C-reactive protein and other pro-inflammatory markers and cytokines. I have just this one study here, but there are several studies that have found an association of long sleep duration and higher mortality. So I think we often focus on not sleeping enough, which is clearly an issue, but oversleeping, like excessively oversleeping, can also be linked to higher mortality rates seen in several studies. And then on a side note, I know we're talking about sleep duration, but kind of relatedly, we also want to think about poor sleep, and especially limited sleep can also exacerbate existing issues. And I really think of pain patients who are dealing with chronic pain and they're not able to sleep well because of uncontrolled pain, and just everything that leads to, including depression. And then people with depression, disrupted sleep can also exacerbate that as well. So I would put this, and this has been recommended in the literature too, that anybody working with somebody with chronic pain should be assessing their sleep and how they are sleeping. So poor sleep is often tied to poor energy, which makes consistent exercise a challenge. So let's very briefly touch on physical activity. Now, I will say exercise is something that can probably be its own echo presentation, but for time's sake, we're just going to cover some real basics here, and we can maybe revisit this another time. So physical activity guidelines. So this is by the World Health Organization and related organizations. They recommend between 150 and 300 minutes of moderate physical activity per week, or 75 minutes of vigorous physical activity per week, or an equivalent combination spread throughout the week. They also, and I think this part is often not recognized as much, but they also recommend muscle strengthening activity at least 2 days per week. So that would be resistance training, weights, things of that nature. According to the CDC, 1 in 5 adults and high school students meet these guidelines. 31 million adults 50 and over, according to the CDC, are completely inactive. In other words, they do their daily living, but there's no other activity beyond that. So the general agreement across the literature is that, physical inactivity is linked to increased inflammation and a host of risk factors for developing disease. There's also agreement that physical activity and exercise is linked to a host of protective factors as well. So the impact of physical activity on metabolic factors and lowering inflammation seems to lower the risk for all these other diseases, or many of these other diseases. So in a particular literature review that's basically just supporting what we've covered here, they found that higher physical activity was associated with lower HPA axis reactivity to psychological stress. And they also found that physical activity was protective against the consequences of chronic stress and disease like depression and even cardiovascular diseases. So again, more of the same here. Another study, a review study, came to a similar conclusion about the protective factors with exercise and cardiovascular disease. And this particular study focused primarily on cardiovascular diseases, not necessarily others. And they did give a caution about exercise. So they said while exercise is certainly protective, there is evidence to suggest that acute cardiovascular events can be triggered in those who are unaccustomed to high-intensity physical activity, who are also habitually sedentary, and have a known cardiovascular disease. So, obviously, one size doesn't fit all. And, we need to be thinking about, the person's previous activity level, their current health, before suggesting and prescribing and so on and so forth, any particular intervention. We also have some literature about depression and physical activity. So DeSano and colleagues found increasing evidence suggesting that physical activity and appropriate diet may assist in ameliorating some of the symptoms of depression. And again, this seems to be through the capacity to reduce inflammation. Fine. Gosh, very sorry about this. Sorry, there we go. So just a little bit on exercise and Alzheimer's disease. So it's been reported that cardiometabolic disease and physical inactivity rank among the highest risk factors for Alzheimer's disease and related dementias. It's reported again that the physical activity really helps to decrease inflammation. And it seems, according to this study, that additional neuroprotective effects of exercise are related to the prevention of hippocampal volume loss. So some simple takeaways with all of this, right? Unmanaged chronic stress has a host of negative effects. Poor sleep, quality and duration has a host of negative effects. Stress and sleep are often interconnected, and other behavioral and lifestyle factors are also interconnected with sleep and stress. So poor nutrition, physical activity, when we're stressed, so on and so forth. So really what this is saying is there are a lot of intervention points here. And there is plenty of evidence supporting lifestyle interventions as both a preventative measure and as part of the already existing treatments. Again, we're not saying discount all treatment that and just focus on lifestyle, again, as part of a wider treatment plan. So this was interesting. This was good timing for this particular echo. So just, within the week or so, there was an article from the Wall Street Journal that happened to be talking about lifestyle medicine. And just some points I've highlighted here from the article is they said that lifestyle medicine is now being embedded in more US medical schools. And they talked about Brown, Harvard, Stanford, and others. The article also talked about the University of South Carolina School of Medicine at Greenville being the first US medical school to incorporate over 80 hours of lifestyle medicine training. They went on to talk about, obviously, the healthcare costs in the United States associated with chronic disease. And they went on to say that the US healthcare system has traditionally focused on treating diseases, and rightly so, rather than preventing it. And they went on to say that the opportunity to reduce costs is spurring new reimbursement models from Medicare, employer health plans, and so on, which offers clinicians more incentives to incorporate that preventative piece. So I'm not sure how everybody else, on the call, what your thought or experience of that is. That might be something we can discuss. So this leads us to our final review of some previous questions that we've brought up in, our previous presentations on this subject. So the literature on lifestyle and health and prevention is strong. But not everybody believes that lifestyle and medicine lifestyle interventions belong in medicine. Does it not? Is there a shift in perspective warranted or not? Do we value and apply lifestyle factors to our own lives as healthcare providers? And again, I would be curious about the students in the room as well. So, there is a lot of, points where we can think of both professional and personal application, of this topic. And then finally, how can we incorporate, if we feel that there needs to be a shift, how can we incorporate more of this into training and practice, especially when we have limited time and budgets and so on and so forth? And relatedly, what about this aspect of health coaching? It's starting to become more and more of a thing. I think even NeoMed has a program offered in health coaching, or they're working on it. So how do we feel about that? Is incorporating health coaching, is that some way to help with prevention and lifestyle? I don't know. How do we promote lifestyle interventions to our patients, especially if we have some patients that kind of want just a pill to relieve symptoms? How do we deal with that? That was a question that was brought up before. And this one stuck out to me a lot. How is the healthcare culture either getting in the way or facilitating some of these lifestyle health prevention, pursuits? So with all that being said, I do want to say that there are some additional resources attached here. You may or may not be interested in this. If you have some interest in exercise, since this was focused on exercise, there is the website here for Exercise is Medicine, which is a global initiative. This site has a bunch of resources for healthcare providers that maybe you find helpful, maybe not. And also, I just got an email from the American College of Lifestyle Medicine. They are offering 5 free CMEs, and I think it's focusing on nutrition. So if anybody's interested in that, I'd be happy to share the email with you. And so, I've included the references for this presentation, but also for the previous 2, in case you weren't part of the previous 2 presentations and didn't get those notes. The references, the sources are all there in case you just want to look on your own a bit. So with that being said, I will go ahead and shut it down.